You did my crow's feet. You look 50 years younger. Great. You did your forehead. You look good. What else is next? The last thing you want is to look like you're straight out of the house of wax. The medical cosmetic industry is a multi-billion-dollar conglomerate that has been around for years, 14 years to be exact, and it seems to be getting even more popular. Botulinum toxin, famously known as Botox, was first discovered as a toxin in fast food. Now we inject it into our faces. Fascinating. Maybe you know someone who's tried it, or maybe you've tried it yourself. No judgment here. But with this injectable treatment, there's a lot more than meets the eye. Before you rush off to that Botox party at your friend's house, let me fill you in, no pun intended, on what just exactly Botox is it safe, is it right for you, and what does it cost, and other important information you probably didn't know. Hey everyone, I'm Dr. Jordan Wagner. I'm a board certified emergency medicine physician, and on my show, I answer your urgent medical questions and clear up myths about deadly diseases. If you haven't already done so, please make sure you hit the subscribe button and turn your bell notifications on. That way you are instantly alerted when I post a new video. More people get this than you think. Botulinum neurotoxin has been the #1 non-surgical procedure since 2000. As of 2015, there have been 4 million procedures performed. It was actually first discovered medically, not cosmetically. Botulinum toxin, also botulinum neurotoxin, was first used as a medical treatment for strabismus, a muscle-related eye condition, in the 1970s and 80s. Soon it was discovered that it also helped treat face and neck spasms, among many other medical conditions. It was actually discovered by accident, believe it or not. The first time botulinum toxin appeared on anyone's radar, it did not have intentions of serving a cosmetic purpose. In 1820, after several dozen Germans died, apparently after ingesting improperly prepared blood sausages, a scientist named Justinus Kerner decided to conduct experiments on the sausage leftovers. He discovered that the food poisoning and subsequent neurologic symptoms were due to improperly canned food. Kerner even injected himself with the botulinum toxin to research and develop potential treatments. This terrifying event led to the first clinical definition of botulism, aka Botox. Later in the 19th century, Emily van Ermengem, a Belgian bacteriologist, discovered the bacterial source of the toxin and isolated for further research. Then in the 1950s, Dr. Vernon Brooks discovered that a small amount of this botulism toxin, if injected, could temporarily relax a muscle. Another man by the name of Dr. Alan B. Scott soon began experimenting on monkeys, as scientists unfortunately have to do sometimes, and discovered that botulinum toxin had the ability to aid in uncrossing crossed eyes. This was the first step toward the botulinum toxin becoming a huge help in treating muscular disorders. However, he also realized that it left patients wide-eyed, which noticeably reduced wrinkles. Now that we got your history lesson, now let's dive in for more information. Is Botox safe? Short answer, yes. It's safe and it's effective. I don't think there are many other products that have been studied as much and as extensively as Botox. However, it's not all FDA approved. So what is it good for? The FDA approved cosmetic Botox in 2002, but to this day, it is only approved for 3 purposes in the dermatological world. #1, in between the eyebrows. #2, the lines around the eyes. #3, sweating under the armpits. Yes, sweating. Just because not every single cosmetic Botox procedure is FDA approved, doesn't mean it's not safe and effective if done properly. Doctors use it off-label to treat other areas of the body such as sweaty palms, decreased skin oiliness, and to treat migraines and more. How does Botox work? Many individuals experience excessive sweating and have turned to Botox and other neuromodulators. Botox blocks your body's sweat glands from activating. The neuromodulator is injected then into the sweat glands to relax the muscle and help combat excessive sweating, or to relax the muscle, resulting in the diminishing of wrinkles. What are the side effects? Every drug has side effects, and Botox is no exception. Luckily, Botox side effects are rare and temporary if done safely. Potential side effects in just 1 in 5% of the cases include mild droopiness of eyelids or eyebrow, which usually goes away within 2 weeks, slight bruising at the injection site, and possible headaches. How long does Botox last for? Clinicians use botulinum toxin by diluting the powder in saline and injecting it directly into the neuromuscular tissue. It takes 24 to 72 hours for the toxin to take effect, and rarely can it take as long as 5 days for the full effects to show. They may last up to 3 to 12 months depending on the treatment. How much does it cost? Botox is administered in units. So to break it down for you, one unit usually runs about $9 to $12. Each treatment averages about 20 to 30 units, which comes out to be $200 to $300 per area. It's habit forming, cosmetically speaking. It's important to discuss with your doctor your plan and understand that it's not an instant, endless foundation of youth. Yes, it's very simple, non-invasive procedure that's done in the office with no recovery time, that is easily accessible and leaves lasting impressions on patients. People tend to go overboard though. Doctors will turn you down if they determine that it isn't appropriate. You did my crow's feet, you look 50 years younger. Great. You did your forehead, you'll look good. What else is next? The last thing you want is to look like you're straight out of the house of wax. Is Botox safe? Botched Botox is rampant. People are getting it done by unexperienced, often unlicensed practitioners who don't know the shape of the face and how to correctly administer the toxin. I just had a patient come to the ER the other day who went to a Botox party. They had significant bruising and were suffering from an allergic reaction. Botox is so commonplace these days that you can get it done in some gyms and spas, but in these cases, you never know what you're getting, how old the product is, with what it's mixed, and with whatever injector knows what he or she is doing. If getting Botox is an interest to you, I suggest you only get it done by a doctor. Definition: a person who is skilled in the science of medicine, a person who is trained and licensed to treat sick and injured people, and attended 10 to 14 years of schooling. I'd recommend either a dermatologist or a plastic surgeon. Some family medicine doctors will do this as well. Who is it right for? It's universal. Unlike some resurfacing or surgical procedures, after which there is a possible pigmentation or scarring problem, when Botox is done correctly, it can be done on all skin tones, races, and genders. According to the American Society of Plastic Surgeons, men's Botox treatments are actually up 337% from 2000. Wow. Botox has both cosmetic and medical uses. It can reduce the appearance of lines and help treat certain disorders related to nerves and the muscular system. If someone wants to try Botox, it is a good idea to speak to a healthcare provider about the risks, the costs, and other considerations. And please, don't get it done at a party. All right, that's it for me. I'm Dr. Wagner, and as always, please leave me a comment, and if you have any other medical questions, please don't hesitate to ask, or share any of your botched horror stories. I'd love to hear about them. Please make sure you hit the subscribe button and turn that bell notification on. Thank you so much for watching, and stay healthy, my friends.